Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them blip-free. This episode tackles other enteroviruses that can make humans sick. Try these cues before we start. Which of the viruses in this group can cause hand, foot, and mouth disease like Coxsackie viruses? Which one can cause polio like acute flaccid myelitis? Which one can produce a neonatal sepsis like illness? Let's go. All enteroviruses are non-enveloped, positive sense, single-stranded RNA viruses with an icosahedral nucleocapsid. Their positive sense RNA can be directly translated into viral proteins. Being non-enveloped makes them stable in the environment and resistant to acid, bile, and detergents. The nucleocapsid protects the RNA and helps deliver it into host cells. Echoviruses, Enterovirus D68 and Enterovirus A71 are closely related to polio and Coxsackie viruses, which we covered in previous episodes. They all belong to the Picornaviridae family. Enterovirus genus. Echoviruses infect cells and cause damage by breaking them open, a process called capsid-mediated cell lysis. They usually spread through the fecal-oral route or exposure to respiratory droplets. Infants, newborns, and young children are most at risk for severe disease. Echovirus infection has an incubation period of about 3 to 6 days, then usually starts with mild fever, rashes, or upper respiratory symptoms, like a runny nose or cough. In some cases, symptoms may worsen over the next few days. Children can develop aseptic meningitis, causing headache, neck stiffness, irritability, and photophobia, or sensitivity to light. In newborns, echovirus infection may appear as a sepsis like illness with fever or low body temperature, poor feeding, lethargy, breathing problems, and sometimes meningitis. EV-D68 mainly infects the respiratory tract, but can also affect the nervous system. It spreads via respiratory droplets when an infected person sneezes or coughs. Children, especially those with asthma, face the greatest risk for severe illness. EV-D68 has an incubation period of about 3 to 5 days and usually starts like a mild cold. Over the next few days, children may develop a worsening cough, wheezing, and difficulty breathing. In rare cases, the virus can cause acute flaccid myelitis, leading to sudden limb weakness, usually asymmetric, affecting the arms more often than the legs, loss of reflexes, and sometimes difficulty breathing. EV-A71 is neurotropic and can cause serious central nervous system damage. It spreads through the fecal-oral route or contact with respiratory droplets. Infants and young children are most at risk for severe symptoms. EV-A71 incubates in about 3 to 7 days and usually starts with HFMD, causing fever, mouth sores, and rashes on the hands, feet, or buttocks. In severe cases, complications may develop a few days after the initial symptoms appear. In at-risk patients, brainstem encephalitis occurs when the virus inflames the brainstem, the part of the brain that controls breathing, heart rate, and blood pressure. Symptoms include trouble breathing, rapid heart rate, vomiting, and lethargy. These problems can cause fluid to leak into the lungs, leading to pulmonary edema, which produces difficulty breathing and low oxygen levels. None of these enteroviruses is linked to cancer. Diagnosis is usually based on history and physical exam, though complete viral identification isn't always needed. Lab confirmation with reverse transcription polymerase chain reaction may be done in severe or unusual cases, using cerebrospinal fluid, stool, throat, or respiratory samples, depending on the virus. Treatment for all 3 viruses is mainly supportive. Echovirus management focuses on fluids and rest. EV-D68 may require oxygen if respiratory symptoms are severe. EV-A71 may need ICU admission for neurologic and respiratory complications. Echoviruses are mainly prevented through good hygiene and proper sanitation. EV-D68 spread can be reduced by practicing respiratory hygiene, like covering coughs and sneezes and hand washing. EV-A71 prevention combines hygiene with outbreak control measures, such as temporarily closing affected classrooms or schools and isolating sick children to limit transmission among children. Let's review. Which of the viruses in this group can cause HFMD like Coxsackie viruses? Answer: EV-A71. Which one can cause polio like acute flaccid myelitis? Answer: EV-D68. Which one can produce a neonatal sepsis like illness? Answer: Echovirus. Perfect score. Sagacious. If you found value in this vid, tap like, share, and subscribe. Check the comp table in the description. Thanks for watching. Stay aboard Med in 5.